Thank you for joining our program at Palm Springs Life Extension and Skin Rejuvenation Institute. Our mission is to help you prevent the diseases and disabilities associated with aging. The success of the program depends on your compliance with taking the hormones daily. If you should have any questions after this instructional video, please do not hesitate to contact the clinic at any time. The HGH is a large, delicate molecule made up of 191 amino acids. The process of mixing needs to be slow and gentle so the HGH molecule will not be structurally damaged in the tiny 18-gauge needle while being drawn into the syringe and while being injected into the skin. Shaking the vial violently will also damage the delicate molecule, thereby lessening the strength and effectiveness.
Hi, I am now going to show you how to mix your growth hormone. This is your vial of Selene B12. This is your dry powder vial. This is your 10cc plunger, and this is your 18-gauge needle. Now what we're going to do is we're going to take the tops off the vials. Always before injecting or mixing your growth hormone, always clean the top of the vials. Okay. Now we are going to take your plunger out of the package. And this is your 18-gauge needle, which you're going to twist onto your plunger. Now we are ready to withdraw the Selene in B12 from the vial. Okay. Now we are going to inject into the powder growth hormone very gently until the powder is completely dissolved. Usually it dissolves pretty quick. Do not shake the vial. Just twist it around until the powder is completely dissolved. So now this vial is your growth hormone. Once it's mixed, it has to be refrigerated. And remember, powder growth hormone is good one year from the date it was shipped to you.
Once it is mixed with our Selene in the vial, it needs to be refrigerated. Once refrigerated, it will last 2 weeks. Beyond this period, it can still be injected, but the strength is no longer 100%.
A lot of times the vial will have pressure, and usually what I recommend our patients to do is you take your 18-gauge needle and you put it into the rubber top of the vial, and this will release pressure from the vial.
If you travel, your HGH will need to be kept in an ice pack to ensure its potency and to prevent bacteria from growing in the HGH. The Palm Springs Life Extension travel bag will help you carry your vials of HGH together with the needles and alcohol preps.
Now that we are ready to inject growth hormone, we are going to take your vial that has been refrigerated and we are ready to inject. We are going to take your alcohol swab. Remember, always wipe the top of the vial. And now we are going to pull growth hormone into the syringe. All the way to number 50. Okay, now we are going to inject growth hormone. Always clean this area of the injection site and wait for it to dry. Okay, now we are going to pull the skin. Now Catherine here has a scar, which is actually good because it's dead skin, so you really won't feel anything. Okay, we are pulling the skin to inject the growth hormone. There's a little gap on the needle, just make sure the gap goes in. And now we are gently injecting the growth hormone. As you can see, Catherine is developing a little bump, and that's how you know that growth hormone has been injected correctly. Do not rub it or anything, just leave it alone. It will go down by itself. And always look for the bump. You can tell that your violet growth hormone has gone bad when it seems kind of cloudy, like this one. This is a good vial of growth hormone, and remember, do not freeze your growth hormone.
Please understand the importance of taking your oral hormones daily as directed. We recommend an organizational tool like a pill box to help with your medications. All oral hormones, including testosterone or estradiol gels, will need to be kept in a cool, dry place. You will find a reminder enclosed in your paperwork indicating when your next blood draw is needed. This is absolutely necessary for our doctors to adjust your dosages, since everyone is different, and for you to make sure that your doctor has hit the optimal target in all of our hormones supplemented. Be sure to mark your calendar and call the clinic when you are ready to have your blood work completed. Please contact the clinic if you have any personal information changes, like changes in your medication through your primary physician, address, or your phone number. You will also find an instructional binder with an employee directory. If you should ever have any questions or concerns, feel free to contact the clinic at any time.